Good afternoon, and welcome to Tales from the Trenches. My name is Stephen Collins. I'm the CEO of Matter. For those of you who don't spend a lot of time with us, we do three things at Matter. We incubate startups. We currently work with a little more than 200 of them around the world and have a suite of services to help accelerate their growth. Second thing we do is bring people together in forums like this one to be inspired, to learn, and to connect with each other. And the third thing we do is provide corporate innovation services to large companies. We have around 60 partners, and we work with them to help them source and co-develop solutions, tackle complex problems, and tune their own innovation capabilities. This is Tales from the Trenches, which is one of our signature programs where we bring in entrepreneurs who have built and who are building particular of how they got to where they are, how they made the decisions that they've made, what they've learned along the way, and what we can all learn from those experiences. In this time of COVID, I don't know if people can hear my 2-year-olds in the background, but if so, c'est la vie, or you might hear children's television, which isn't doing a great job of occupying his attention at the moment. But these are the times we live in, and both our moderator and our guest have children as well. There are children or dogs in the back. The leading women's and family she started the 5 million women and families. She's raised almost $90 million to fuel the company's growth from really signature venture firms. She actually came out of venture capital herself, and actually the part of her background that I find the most fascinating is that prior to all of that, she was a journalist working for The Economist and The New Yorker in reporting from Southeast Asia, New York, and London. And those are really two of the best publications in the world. So it'll be interesting to see how she made the transition between that and what she's doing now. Our moderator today is Paul Martino. He is the co-founder and the chief growth officer of VillageMD. He has been in health, really driven growth and fostered really pleased to when the main portion of the program is completed. If you have questions along the way, please submit them using the chat function, and Paul will take a look at those questions. He'll see them as you submit them, weave them in, or dedicate a portion of the program to those questions. So with that, I'd ask Paul and Kate to turn on their videos and thank you for joining us. If we were in person, I would ask you all to give them a big round of applause, but that would be, you'd probably feel kind of silly doing that. So don't worry about that, but please welcome Kate and Paul. Thank you.
Good afternoon, Kate. How are you? Thanks for the introduction, Stephen.
Yeah, thanks so much. Happy to be here.
So, Kate, the ultimate multitasking. We're going to carry on a conversation. We're going to respond to questions from chat. We've got kids and dogs in the background. Got a couple extras if you need them, by the way. So tell us, Kate, where are you sitting today and what's the environment like? Just to...
Well, normally my answer to that question is Connecticut, because I moved back into my childhood home 2 months ago, from New York City. to have a baby like in the next day or two. And so my family and I, we've come back to Brooklyn where we live, and we're currently in our place in Brooklyn, for a few days.
And all is good and safe?
All is good and safe. We are, my kids are happily in their rooms and playroom again, and my husband and I have our things again. So, it actually feels pretty good today, to be honest.
That's great. Where's your sister going to deliver? In the city? Yeah, that's great. So safe environment, good environment. Looks like a decent day there today. Before we jump into you and Maven, how has this whole pandemic impacted you? And then later I'll get to the impact on the business.
Sure. So how's it impacted me? I think, well, so I'm, on the one hand, I think we can all say I'm just so grateful that we're okay. I mean, I feel gratitude every day because I know there's a lot of, tough stories out there with unemployment and economic hardship and illness. So, when the days get really boring, as we're all kind of sitting in our homes, I'm constantly reminding myself of that. I mean, we have, I live with my parents, so I'm getting to see a lot of them right now. And, I'm thinking the silver lining is I'll probably never spend this much time with them again. So, trying to enjoy our bridge games and, my dad's politics. And then, I think I'm a huge extrovert. So, I'm definitely going a little stir crazy. My husband's an introvert, and so he is, he's just fine.
He kind of likes it this way.
Yeah, but I think I'm definitely going a little stir crazy. Not being able to move around. I was even when my husband and I were talking last night. My life used to be just on planes, at breakfast, lunches, dinners all the time, and it's just being at home for 2 months with my kids playing downstairs and with all my family around. I mean, there's a lot of great stuff to that, but I definitely am starting to go stir crazy.
Yeah. Yeah, it is a bit challenging. I'm curious, what do you, especially where you sit, in Illinois, where we seem like we're taking a slow path to reopening, and maybe New York is doing the same. Have you thought about the reopening and how you personally are going to get back into the environment you just described, where you're breakfast, lunch, and dinner, and how do you think about that?
I think obviously the world that we're re-entering has completely changed. I think a lot of it is about risk tolerance, right? And so, honestly, if I look at what what decisions I'll make after this, it really is. I haven't had COVID yet, because I live in New York. I know a lot of people that have had COVID, including a lot of family members. And so, I think it's one of those things that, as we resume our normal life, there's definitely, I think, going to be, there that continued fear of, will we get it? Will we get it? And I think, at the end of the day, it's just gotta, you just gotta carry on. And so I'm going to travel when I need to. I'm going to, see people, obviously taking all the safety and the precautions, of masks and, social distancing, when I need to. But I do hope that, I personally want to jump back in, while maintaining, safety and whatnot. Because I think, but again, that's just, so much of how I learn. I'm an ex-journalist, as Stephen said. So much of how I learn is from people, from experiences, particularly in healthcare, where it's a really complicated industry, and so many ideas that I've even had for Maven come out of conversations with really great, with really great healthcare leaders and smart providers and just smart people. And so I think, I've obviously been doing a lot of this over Zoom, but I'm very excited to get back into real life at some point.
Yeah, yeah. It doesn't have the same feel when it's done by Zoom or by phone, at least not for me. So you've mentioned, and Stephen mentioned, journalism. Give us a little bit of your journey. How did you arrive at journalism? And then from there, I don't know if Maven is your first rodeo. I don't think so. So just give us a little bit of history on that.
Sure. So I'll tell you a fun story, from living in my childhood home over the last 2 months. So my dad actually, he printed out a binder of all the emails I wrote him between 2000 and 2010. So basically when I went to college, I went to Michigan. So the first email is about, congratulations on your acceptance of college. And then I got married in 2010. So it kind of, it spans those really interesting years. And so, and so I was reading some of them because I'd never really, really seen this, but I found it in my closet in my bedroom at home. And I was reading some of them, and there was this email. I was like 22, I think. I had just moved to Spain, and I had written, now's the time in my life that I want to get out and I want to see the world and I want to experience the world because I'm going to be the best journalist there is. And this is just, how all the best journalists were made in the past. They have to just get out and see the world and experience it. And I think, I was writing this to two very worried parents that were like, oh my God, our daughter's just moving and traveling and, is she ever going to come back home? And so, but yeah, I think that was really my early desire, graduating college was to really, to build a career in journalism, to be the female Hemingway, to tell stories that matter, and so I had a great run for most of my 20s, actually. I lived in Spain, I lived in London, I lived in Southeast Asia. I covered stories for, eventually wrote for The Economist, but I also wrote for Fortune, the Wall Street Journal, just, stories about international business. I did some science writing for The Economist. So I'm proud that 22-year-old who wrote that email, I eventually did do some of it, and then obviously, left the industry to go into entrepreneurship.
And so bridge the gap for us. From there, you first started Maven, or did you do something before you started Maven?
So I tried to start my first business when I was living in Singapore. I had a friend in Hong Kong, and he worked at Goldman Sachs, but also, lived a very, very entertaining and life where he did lots of fun things all the time. Lots of, he traveled to lots of places. He knew a lot of, people who like to have fun. And so we were talking about, I had just written a story, I think, on the online travel industry in Asia. And so I was in Hong Kong visiting him, and, he was taking me out to all these nightclubs, and we were having a great time. And he knew the editor of some luxury magazine over there. I was telling him about how all of these amazing online travel ideas from the West were making their way to Asia, and there were so many business opportunities. He's like, well, let's start the business. And so we tried for 3 or 4 months to get something off the ground, really localizing travel to the Asian market with a lot of the new hotels opening. And it was a really good idea. I think anyone who eventually did it, or I'm not sure if they did it, it really catered to a lot of the new consumer trends at the time. But I really didn't know what I was doing. And so I decided to go get more experience first, before starting my next venture. So I ended up moving to London. I got a job in venture capital. I worked there for 2 years. And really that was the launch pad from where Maven was born.
And I bet you got a lot of advice along the way, right? I imagine your dad had something to say.
I think I was, we were on some ferry from Singapore to Indonesia to Bintan, and I was very excitedly telling him about my idea and and my friend Yalen's idea and how we were gonna really launch it, and it was gonna be big. And he was like, okay, well, maybe you should go get some other experience first and learn on someone else's dime before you don't learn on your own dime. And so that was, I think, pretty good advice.
Yeah, probably great advice. So I think about starting a business, and I know what was going on in my mind when we were thinking about VillageMD, which was a long time coming. How'd you come up with the idea? What was going on in your mind that you thought Maven would be a viable business, a good business, one that people would gravitate to? You have over 5 million users. So talk about that a little bit.
Yeah. So as I'm sure, I don't know what the founding story of VillageMD was, but, I think sometimes the media likes to portray founding stories as this light bulb moment that, you had no idea and then you had one. But I think really Maven was born from a lot of an accumulation of a lot of different trends and personal, needs that I was seeing from my friends and whatnot when it related and came to women's health, particularly as it related to starting a family. And so, I was trying on a lot of different ideas at the time that I was working in venture capital, knowing that I eventually wanted to, leave and start something. I think one of the things that always was consistent was actually helping, helping either women or underserved communities. Even the hotel idea in Asia, it was all about training local workforces as, hotels would open up there and bringing more skills to the regions that didn't have as much training. And so with Maven, I mean, or with, some of these ideas that I had, a lot of it was, related to that or to women. And so there was this one business idea I was looking at one point around, helping women understand what the genetic diseases that they have and how to prevent them. And I think it was more of a vitamin company type of idea rather than a, online digital clinic or, an online clinic for women. And, but there was an element of online nutrition to that. And so I think it was, as I started to, really talk to my friends, really look at my own self into what the needs were. A lot of the core needs boiled down to access, getting the right information, and then accessing the right providers when you needed them. And so at one point, the aha was, oh, what if I took this part of this idea and then made an entire, virtual clinic that just supported a lot of women's health needs and children's health needs.
And so, so you had the idea, you wrote the business plan. Is that right?
Well, I mean, does anyone write a business plan anymore? No.
It's just PowerPoint slides and a story.
Yeah, exactly. I actually, what I did is my aunt and my mom I grew up helping them when I was a journalist. They had a focus group business. So they would go to big, brands and whether it was a new product launch or, new branding, they would do tons of focus groups and I would write the reports. And that was how I paid my rent when I was a journalist, because I wasn't exactly making a ton at the time as a journalist. And so, that was kind of what I did first. I had a bunch of focus groups, after I kind of had landed the idea and tested it out with my own friends. It was probably over a month of Sundays at the offices of the venture capital that I worked at, and just asked tons of questions, to all of these women and to providers as well. What is it that you need when it comes to women's and women's health, and what are you not getting? And then we tried the concept, this virtual clinic. Is this something that you would gravitate towards and that you would use? And so, it was through that the pitch deck came. I raised the first $50,000 for the business. After these focus groups, I went out to lunch with a partner from Index Ventures, which was the VC that I was working at. And I didn't even have a pitch deck at the time. And I just kind of, was talking to him about the idea. And he goes, it sounds like a really great idea. And, count me in, I'm your first $50,000. So between the focus group saying like, yes, we need something like this, and then all of a sudden, a commitment of capital, that was really what prompted, the real pitch deck and the real fundraise to get the business off the ground.
And how'd you think about team, right? So now you've got some money, you've got an idea, you now need to think about what are we going to do to get it going? Who did you talk to? Who did you think, boy, that person would be a really good first recruit? How did you process all that?
Yeah, so I had actually had a friend from when I worked at the New Yorker who had, Sally Errico, who had pitched me an idea about a year earlier to start. That was actually, it was, I don't know if she's going to do it one day. It's a great idea, so I'm not going to give it away. But it had to do with the prenatal space. So I went back to Sally and I said, hey, would you want to kind of run marketing and content for this virtual clinic? I think a virtual clinic's going to need to have a certain amount of content. So she's like, great. So we started kind of collaborating. And then the next thing was like, okay, well, we need an engineer. So I started to go to female developer meetups in London. And that was where I met Susie Grange, who, was our first engineer. And so then it was Susie and Sally and I kind of, playing around with concepts, ideas, branding. And then I ended up going to a wedding. So it was all kind of personal network, but very deliberate in how I was recruiting. Susie is a front-end engineer. At a certain point, we needed a back-end engineer. So I went to a wedding a few months after Susie, Sally, and I started concepting everything. And I think in those early days, when you're starting something at a certain point, if you become very laser focused, like everything you do every day is almost like, to help launch this company. And so I went to this wedding in April, and it was April 2014. And this guy, Zach Zaro, who is a friend of a friend. I didn't know him that well, but I knew he's this great engineer from a advertising company called Percolate. And so I switched our place cards so that we could sit next to each other at the wedding. And, sure enough, Zach came on as our CTO, a month or two later, which was great. And actually Susie's still at Maven. Zach works with us for 5 years. So, we really, like this early team actually, stayed with us and scaled with us for a while. And then I had a friend from high school who was at Columbia School of Public Health. And so she was between her 2 years. And so she said, hey, why don't I just do an internship for you? You can give me some equity. I know you don't have any money, and I'll help you get everything off the ground. So she was kind of doing clinical ops and helping us recruit our early providers. And then we hired an iOS engineer, Jason, who's still with Maven today. And so we really had, we call it like the garage band days. But it was really, those are some of the most fun days before you launch.
Sounds like more like the wedding crash. Expecting the shameless behavior of you. So you have to love the crowd that we're in front of today, and it's fun virtual. It's really interesting. But there's a couple of questions that came over. First one, not a question. It's the plug for Michigan, so it's the woohoo go blue. You expected that one,
yeah.
But and by the way, and I love your friend who said, I know you don't have any money. Like, they just get it right out there, right? Like, you're broke. Let's see what we can work out here. So one of the questions was, how much equity did you give up for the 50,000 seed round? And did you provide stock options to early employees and low salaries? So this is exactly what I would have expected from the crowd. Talk about that a little bit.
Sure. So actually I had in the early days, I actually only gave myself 75% of the company, knowing that is 25% went to early employees, and that was normally employee share option pools are typically around 10%, and so it was a large amount, and I think it was simply because I just knew I needed as much help as I could get, and that people, particularly in the early days, if they had kind of had an option, take salary or you could have more equity, and so some of our early teammates decided to forgo salary in the beginning to take more equity. So we were really, really cash conscious on everything we did. And then in terms of how I had worked in venture capital, so I did kind of understand the mechanics of seed funding, and so what I did was I did an open convertible note. So it allowed me to. We didn't really have, we had a prototype and we had a team when we raised some of our first money, but we hadn't launched the business yet, and we needed to build out a certain amount to do so. And so I looked at our seed round and two people who I knew, friends and family. And that was about the first $1 million coming in, but I knew I needed, more. And so I left a convertible note open, knowing that, and plus I was moving from London to New York. So I knew that if a lot of our friends and family was from London, I knew I wanted some New York investors as well. And so we used the first $1 million to build things out. And by the time, we were about a few months away from launching the business, that was when I closed out the rest of the round.
And so maybe keep going on that. The convertible note, presumably they could convert to equity in the company, or presumably it came with some kind of an interest formula on it, or they had the ability to convert?
Yep, exactly. So at a certain point, we had a priced round, and all of the notes converted. And so the convertible note was capped. I believe it was like something like 10 million cap. And then when we did a priced round, all the notes converted to the with the 10 million cap to the round that was priced.
So here you are now, a couple of rounds later, right? You've raised B and C, and so. Describe the state of the company today. How many employees? What do you think about in the future? I'm also interested. I'm a board member of a company called Women's Health, And I don't know if you know the company. They're a Connecticut-based company right up the street from you in Avon, Connecticut. And compare and contrast a little bit if you can. I think most people know some of the women's health businesses that are the what I'll call legacy brick and mortar. This is a digital clinic. So I want to understand that connection. But first, state of the
Sure. So let's see, we're about 125 people. We've raised about 90 million to date, and we're headquartered in New York. So in Tribeca, although our sales and client success team, they're in region. So, that's a remote culture. And, we are still hiring. So we're hiring, we have about 20 open roles, which is great. We are seeing continued growth in our sector. Our core business model is that we sell family benefits into employers and health plans, and so fertility programs, pregnancy programs, pediatric and return to work programs, and parenting programs. And so I think, particularly given that telemedicine is so central to our product, we run the largest women's and family health telemedicine network today with over 2,000 providers across 20 different specialties. And so I think our clients are seeing us as an essential benefit, as well as prospects, given that a lot of disruption has occurred to routine maternity care, pediatric care. And so we've been able to, support our members and even sign. We just, this is public, but we when we rolled out Mass Health a month and a half ago, that's Massachusetts Medicaid plan through the state governor's office. That was directly to combat and to help support all this disruptions with COVID and better support that community. So we're also doing a lot of COVID specific work right now as well.
So talk a little bit about the impact of COVID. I mean, have you seen a change in your business because of it? Are people baby boomers, given what's happening, right? And so are people using your service more, service less? What's the impact?
Yes, people are using us more. Our utilization across our platform is up 50% since the crisis, but in certain segments like mental health, it's up 300%. What we're seeing is just, and even what's interesting on the mental health side is a lot of the mental health that we were seeing before COVID occurred postpartum or kind of when parents were going back to work. But right now, a lot of the spikes in mental health are for pregnant women. And I think it's because of the uncertainties around delivering a child right now. A lot of people are getting their routine prenatal visits canceled or pushed off. For someone coming into a pregnancy with those anxieties, whether they've had miscarriages in the past and this is their first viable pregnancy, or whether they're high risk, they already have heightened anxiety and they're not able often to reach their medical professional, that they may be seeing in person. And so, I think that, and then postpartum as well. I mean, people are being discharged from the hospital, relatively quickly now. And so there's just a lot of postpartum care and needs that are now being done, virtually. I mean, most of them already are, they already were being done virtually because there's not a ton of, postpartum support in those early weeks in general, but we're definitely seeing, I think, even an increasing spike there too.
So are you in network with payers? Talk about that a little bit. What's your business model?
So we're basically, we manage the condition of pregnancy, of fertility, of those early pediatrics. And so you can kind of think of us as almost like a wrapper to a lot of the in-person prenatal care and delivery that someone's getting through their core provider and their health plans paying for that. We're the one that's kind of, the care management platform around it. And so whether it's, supporting the middle of the night OB or pediatric calls, whether it's actually, taking someone with gestational diabetes and helping them, manage that condition, manage their weight, manage healthy eating, whether it's, helping a new mom, recover and give her lactation support, or, screen her for postpartum depression and then give her maternal mental health counseling, whether it's career coaching to go back to work, or, pediatricians or pediatric occupational therapists or pediatric allergists for all of the kids' needs coming up. It's really, that wrapper and that's filling in some of the gaps that exist with in-person care.
And paid for by the consumer themselves? Him or
No,
herself?
the employer pays for it and the health plan pays for it.
I see. Got it. The future, talk about that. What's your growth plan look like? The trajectory of growth? Are you thinking and considering a public offering down the road? What's in the future for you?
Yeah, I would love to remain independent. I think the world needs, delivering better care to patients and is very patient centered and patient focused. Our growth trajectory, it remains, I mean, in some ways it remains the same, right? We're selling to employers, we're selling to health plans. I think one thing that we've seen is given how hard hit underserved communities are right now, with COVID, and that we're actually moving faster into Medicaid and some of those areas. I think before COVID, we thought it was going to take years, to start working with some of those communities. And I think what we're now seeing is that there's an openness to innovate because of, obviously the massive disruption to care, but also because of some of the most vulnerable communities are getting so hard hit. So that's
But
really,
don't you need a different, when you jump into the underserved community, it strikes me that you probably need a little bit of a different skill set in order to provide service to those folks. How do you think about that?
yeah, I think to offer a pregnancy program, definitely. We've already looked at how we would be recutting some of our existing products, but we're also able to just be a provider. So offering per visit telemedicine to some of these communities with care advocates, helping shepherd people to the right providers with the right language or the right, if someone has preferences on race, on gender, in terms of what types of providers they're seeing. We do have a care advocate, a very strong care advocate network that is really quarterbacking everything that a member.
Is that a network that you built, or did you tap into a network?
No, we built it. It's all in house.
Got it. Got it. Talk about your tech platform a little bit. What was the development of that? How did you think through the development? What was going to be important from a patient experience point of view?
So we, Zach, our CTO, the first 5 years, we were really lucky because Zach called very early on that given all of the HIPAA issues and just kind of maintaining complete ownership over our data and our privacy practices, we actually built almost everything in-house. So even our analytics platform that would just track how members were using the app, we didn't do any kind of data sharing with a lot of these third parties, because we knew that as we got into contracting with major health plans, Fortune 10s, Fortune 50s, that there was going to be, we needed to pretty much, build everything ourselves. And so I think there's also just more these days that, you can sign BAAs with platforms and you don't have to necessarily build all the tech yourself. But when we started in 2015, there wasn't as robust of an ecosystem. And so we built mPractice, which is our provider app and our provider software. And that has we built an EMR in that the providers, use for their patients. That's what is writing we hook in so they can write prescriptions and whatnot. And then we built the patient software, which is, the video appointments, the scheduling and whatnot. And then eventually, after we were done building the core telemedicine, that was when we said, okay, now let's build this very kind of personalized pregnancy program that at the end of the day is everything that you're doing. It's to drive a healthy outcome, whether it's reduced C-sections or, not going into labor prematurely. And so, after we were done with the telemedicine, that was, everything else, the content, the communities, that was all layered on. I think one of the most exciting things that, a lot of people in the early days were like, why would you do all of that work? It was like 2 to 3 years of development work to build out this big telemedicine platform going to drive the outcomes. And so now that we're, finally at a point where we have the level of volume that we need to drive to, do the studies, what we're seeing is that, people using, people with better outcomes, they're the ones that are using the telemedicine. So for instance, someone who breastfeeds longer, like they're 3 times more likely to use a lactation consultant on Maven. And so you're starting to draw a direct line between people using specific elements of our telemedicine and then the outcomes that they're getting.
Yeah. Are you in business in all 50 states? And I'm curious, how do you deal with any licensing requirements or state regulatory environment? How does all that work?
Yep. So this is what we built the first 2 to 3 years of the business. So we operate like, we have the same setup as Teladoc or American Well. We have a professional corporation. Some of our our providers are through the professional corporation. We have certain providers that we've gotten licensed in all, 20, 25 states. And then we have a group of providers that work for us. And so, we are able to kind of, and then, we have a larger network of specialists that are kind of long tail. But yeah, I mean, through all of this, we have at this point, a complex system that's monitoring utilization rates, availability per state, and whatnot. And so we are, we now have really tight SLA times. I mean, I think the people, if you go on Maven right now, you can book a certain number of appointments with a certain number of providers. So
Yeah, got it. So what do you measure? What kind of metrics are you looking at? How do you know if you're getting the kind of patient experience that you sought out to get? How does all that work?
yeah, so we some of the how people rank their care advocate and their provider after they talk to them. We collect those types of ratings. Post program, like, we're obviously sending them post program surveys, understanding, what they thought of it. But then in general, I mean, it's measured by time spent on app, how many telemedicine visits they're doing, what they're clicking on. We have this thing in our product called a member action plan, which is every week of pregnancy, everyone gets a certain number of things to do, micro steps to drive towards a healthier outcome. And so, how much is someone engaging with that? We look at, how are people clicking into, certain, we have thousands of articles at this point. So, are they clicking into certain streams of articles, and are they engaging with their community? So, we have kind of a hierarchy of engagement that looks at all of the different features and all of the different engagement touch points in the app. And then we rank ourselves on that hierarchy, where obviously, doing a telemedicine visit is a much more, a higher level of engagement than opening an email. And so but we're constantly looking across our users to make sure that their engagement rates are, at a certain level. And then, some of the personalization that we've put in the product and we continue to invest in, that's really what's driving the engagement. Because if we know a member, really loves, I don't know, nutrition, it's like what they're engaging with in the app, then we're going to continue to serve up helpful things that help them achieve their goals. And so we're able to, continue to also just personalize all of the experiences that members open up when they open up the app every day.
And I'm curious, you work with employers, you work with payers. What do they want to see from you?
In terms of reporting?
Yeah.
Yeah. So I think the high level, right, is on the payer side, it's the outcomes that we can drive. It's just two areas. One is the clinical outcomes, and then two is the business outcomes. The clinical outcomes could be things like, reduce C-section rate, or reduce NICU admissions, reduce days spent in the NICU, avoidance of ER visits. The business outcomes might be, retaining women in the workforce, or increasing rates of productivity, or reducing days of absenteeism. And then some of the other kind of like more health outcomes might be, increasing utilization in mental health services if someone screens positive for postpartum depression, or increasing length of, breastfeeding, increasing. So, there's a bunch that we do, but we really do bucket it into these two areas.
So I want to go back to the tech platform a minute, and I want to tie that to capital raising. I know in my experience, we have a tech platform that's a proprietary platform. And when we were raising capital, the diligence process was pretty onerous. Can you talk a little bit about that, and how did you handle that in the capital raising process?
Yeah, I mean, the diligence, this last one was definitely onerous, but, I think we have an amazing team of lawyers, and we open up data rooms, and then, and then everything gets scrutinized by the investing party. And so it's a combination of, our finance team and our legal teams to kind of just open the door and go through everything. I think what has helped us though, and I'm sure this has helped you guys as well, but we do work with pretty sophisticated employers, Fortune 10s, Fortune 50s. And so as we go through complex IT security protocols and processes, we've been through some that have taken 12 months. And so that, I mean, in some ways that's even more scrutinizing than some of the diligence that goes on in investment process. I remember there was this was in like 2018, but one of the questions in this like endless security assessment form was like, do you have a lock on your paper shredder? And it was like, we don't have a paper shredder. We're a digital company, but like the level of detail in some of these security reviews is pretty intense.
Yeah. Yeah. The paper shredder question, they must have been in a doctor's office recently, right? They're still faxing things around.
Right.
One of the questions that came in, which is a really good one, you had said that when you decided to leave journalism, you went into venture capital, correct?
Mm-hmm.
That's not necessarily an easy transition. Talk about that a little bit, because then I suspect that informed your thought process around how you valued the company and how much equity you would give in the early stages of the company. Always a tricky part of the business.
Sure. I think so. The reason I went into venture capital, it's completely deliberate. I moved to London in 2011. And so it was right when the Eurozone crisis was truly hitting. Everyone thought the euro was about to collapse. Greece was going bankrupt, and there were genuinely no jobs. And so not only were there no jobs, but for someone who was trying to transition industries and careers, it was really tough. So I had about 8 months where it was brutal. I mean, I had over 100 meetings with people just trying to get any job. I was trying to go into finance or venture capital because I had worked with Hank Paulson, the former Treasury Secretary of the US. And so Hank was my reference. So I thought, with Hank as my reference, I should be golden to get a job. And it was still really, really hard. And so I finally met this partner at a venture capital firm, and he said, okay, gave me like a case study. I sent it back. And then over the weekend, he was like, okay, I'll give you an internship. If you can do it, then you can join us. And so it was really, really lucky. And who knows if Maven would exist today if I had gotten a job at Goldman Sachs instead of, Index Ventures. But, and so it was truly, that was the transition. And it was a huge learning curve particularly that first year at the VC firm, because it was like my business school. But it was great because I was able to attend board meetings as a board observer, and I was able to participate in partner meetings where I would hear the partnership discuss companies and what worked and what hadn't. And I met so many entrepreneurs and learned from them what worked, what hadn't. And so it was just an incredible incredible education that ultimately I think, I've made plenty of mistakes at Maven, but helped me avoid some.
Yeah, I want to get to the mistakes in a minute, but before I want to get to both the mistakes and those sort of pleasant surprises or aha moments that you've had along the way. But before that, question from the audience, and I love this question. Providers and quality around providers. How do you know they're high quality providers? What's the process that you use? How do you deal with a provider if you learn that they aren't creating the experience that you want to create?
Yeah, great question. So it's the first thing we actually built. It's still, today, if you go on our website and you go click at the bottom, mavenpractitioners.com, we actually have a vetting process for everyone who comes onto the platform. So, we have 20 different types of way that we would vet a physical therapist. And so we have peer leaders across each of these specialties that actually create the test, create the case study, do reference checks, and interview each individual coming onto the platform. So we have a 35% acceptance rate, which is pretty low. And I think we're able to keep it that way because we are the largest. And I think we have a pretty good reputation among our providers. So they're also, on Facebook groups of doctors and physicians. I mean, we really do listen to our providers. We try to create what they want to create. If anything, we have so many providers that are setting availability right now with COVID, just trying to help. Like we have more capacity than we've ever had in our supply base, just offering appointments because we've just seen such volume there. And then we actually, once someone comes onto the platform, every appointment is rated afterwards. And so, we get automatic alerts in our system. It's on a five-star scale. And so if something goes below 4.7, we get an alert. Our provider operations team will investigate it, reach out. It's funny, we, knock on wood, but we, from a quality standpoint, it's been extremely, great to see that it's very high. One of the weird things that we had an issue with is that our providers, if they get a booking, but let's say something happened, they're in a car or something, instead of kind of canceling the booking or letting us know like, oh, it's in 10 minutes and I had to just jump in a car because there's an emergency and I had to get in the car, so I can't take the appointment. The providers were actually taking the appointment. And so sometimes we would get like, hey, I just talked to my doctor, but she was in a car. That's kind of a weird experience for the patient. And so we actually had to do this big training where we were kind of like, listen, it's okay to cancel appointments. And our care ops team and our provider ops team will rebook for the patient with someone else. But, just kind of really doing training around like when someone's doing a telemedicine appointment, they do have an expectation that it's going to be somewhat, like they're like the provider.
No kids running around in the background, no barking dogs, HIPAA compliant, right? There's an expectation.
Yeah.
What keeps you up at night? What worries you? What do you think about that, bad things that could happen?
I mean, the economy right now, I think that, not just for Maven, we're living through a really scary time. I think there's still a lot of uncertainty. A lot of family members, friends, and just our community has been so personally hit, with lost jobs, with illness, that's just not an environment that's good for any society in any country. But I think as an entrepreneur growing a business, I think the responsibility feels greater than it ever has to really make sure that we're making all the right moves in this moment so that we're, holding true to our mission of improving access to care while being, really, really cognizant of the costs that we're incurring as a business. I mean, I think every business is watching their cash right now because there's so much uncertainty in the economy. So, I think a lot of that keeps me up at night, that we're not going to have the growth rate that we thought 4 months ago because, there's just entire industries that have fallen out of our pipeline. So we're still, growing. I mean, we're hiring 20 people right now. So that should give you a good sense of growth, but we would have been hiring 40,
Yeah.
So.
What about access to capital? Do you worry about that? Like you said, there's, as employers are laying off people, they become unbenefited. They're now potentially COBRA eligible. How do you think about your continued growth vis-a-vis the capital markets, right? There was something that came out today that said that accessing debt is going to get harder and harder.
Yeah, I think we're not like 2 years away from an IPO. And so, that we're not, we're not planning to go, we were never planning to go public anytime soon. So I think, by the time that hopefully that happens, this will be, this too shall pass. I do think, we're really lucky. We just raised our growth round, our Series C in February. So we do have a full, a bank full of cash, so to speak, to weather the storm, should growth rates slow over the next few quarters. And I think, it's just, making sure that we're making all the right calls. I think operational efficiency is so important right now. And it's hard because we're in a work from home environment that we've never been in before. I mean, we've actually transitioned beautifully and our productivity is fine. I think people just really miss being in the office. And I think I have larger questions of how long can we be productive in this work from home environment, but so far it's been okay. I just think, at a time when you should be driving the, operational efficiency so that, you can hire 20 people and not 15 because, you know, you just aren't being efficient internally. Just thinking through how to continue to, you know, scale and build this as we are in a work from home environment is one thing definitely top of mind. And then investing in the right growth areas. I mean, we actually just acquired a company, so that will, you know, we'll, I think, probably release a press release on it next week or the week after. But you know, and that is an important part of our long-term strategy. So making sure that we're also seizing on the right opportunities too.
Yeah. The whole process of trying to hire people in this environment is really kind of goofy, right? No one, usually somebody in the company gets to meet the candidates, but right now there's no meeting the candidates. Everybody's being interviewed and hired in this type of an environment.
Well, actually, that is not true. I am meeting candidates through car windows. So I am actually having meetings in parking lots through cars.
Oh boy, the Night Stalker.
Yeah, it's kind of weird because this is for a C-suite position that we're hiring for. So I clearly really want to meet this person, and so yeah, I'm like, you know, hey, so do you mind like meeting halfway between you and me? And it would probably be like in this wooded area in a parking lot. Everyone's down for it though.
Dusk would be a good time for us to meet, right?
Right.
So fascinating story. How'd you pick the name Maven?
Well, so Maven means expert in Yiddish. And so if you think about what we're doing, we're kind of an expert for women and families as they go make their healthcare decisions. And each provider on Maven is an expert, and we're trying to make our patients become Mavens themselves. So, you know, we've had a lot of fun looking at all the different ways.
Was there a lot of debate around that at the beginning, or did you know it was going to be Maven right out of the gate?
Oh yeah, actually the first name of the company was HealthXX, which everyone thought was a porn site. And so that quickly, it was HealthXX for like 2 months until finally we just, the confusion was too much.
Better than Health X, right?
Exactly.
A low budget porn site. So, you know, there's a lot of young folks, I'm sure, listening in on this. Brilliant, get us out of the gate for you, 40 under 40, really fantastic track record. What advice do you have for the people listening in today, especially females?
Yeah, I think, you know, find the confidence that you have within yourselves and then just persevere. And I think, you know, at least for me, I got so many no's, and so I still get so many no's, by the way. Like every day I get no's, even from my own internal team. It's like, can we build this? No. But basically, I just think if your patients, or, you know, the users of your product need the product and the business model makes sense, just keep going. And so I think I wasn't quite sure of those things, and obviously before we launched, but just I would get signals from patients early on, that, you know, they would give us the feedback, wow, this really, really helped me a lot. This really mattered. And so, you know, I think that if you know, if you have those stories in whatever you're doing, just keep going, because I think the world needs more female entrepreneurs, particularly.
And so you mentioned early on, you had children, correct?
I do.
And their ages?
3 and 2.
And boys, girls, how does it work?
My son is 3 and my daughter is 2.
And who's the boss of the two of them?
Oh, increasingly my daughter. She is just coming into her own right now with, you know, lots of sass, kind of learning how to talk, but she definitely has a lot of opinions. My son's, you know, cuddles with me. My daughter hits me.
Typical 2 and 3-year-olds. So personal question, what do you want them to know about you? What's going to be your biggest teaching for them as they grow up and mature?
You know, my husband and I played this game the other month. Like, what are the 3 things that, you know, values that he wants to imbue on the children, and what are my 3? But I think truly, one of my top ones is like teaching them how to have fun in the world, and how to be optimistic, and how to take lemons and make lemonade. You know, I think I couldn't, you know, I would never, Maven's a lot of fun. I'm having, you know, a great time building this company with the team. And so, it makes the no's, it makes the rejection, it makes kind of some of the, the less glamorous parts of this, it makes it all, worth it, or it mutes it a bit, because if you're having fun, you love your team, you're building a great product, and you're constantly looking for ways to make, lemonade out of lemons. I think if I can give my kids those tools, then they'll hopefully, be happy people, and hopefully do something where they give back.
Great. The happiest moment since beginning Maven, what's been the one thing that sticks out in your mind and just really brings a smile to your face?
Honestly, it's when I see internally some teammates grow. Like, there's one of our director of care advocates, this woman, Caitlin, when she started at Maven, she had never worked in business before. And now she's running a team of, about 15 people. And so she's phenomenal. I mean, just watching her grow has been a huge pleasure. And I think, there's so many team members like that at Maven, where, whether they've been at Maven for 6 months or whether they've been at Maven for, 4 or 5 years, just watching people come into their professional own and thinking and getting such job satisfaction and loving where they work, makes me really, really excited.
That's great. And the one thing, there's got to be one thing, if I had to do it all over again, fill in that blank, what would it be?
Let's see. Yeah, so many things. I think, and again, it maybe goes back to people, startups are just a bunch of people working together. And so I think in the early days, I had never really hired before. And so I was just kind of, I didn't have any rigorous process around hiring. It was kind of, and so I think that one of the most important things that I think I would have changed, or advice I'd give to early founders, is really invest a lot in your hiring processes and practices early on, so that, when you're bringing people on, that, that you're making all the right calls. I think in the early days, I didn't have as much experience doing that.
What's the one word you would use to describe your culture of the company? What are you trying to create, and why?
I think mission driven. I mean, it's what everyone says too. We do surveys. I think we always score really high on people are really proud to work for Maven and really mission driven. And so that, that's great, because, at a startup, you have to work really, really hard. It's not easy. There's a lot, you never have enough resources. There's always lots of no's before there's a yes. And so I think that, but people at Maven truly, they see the impact we make with our patients. Our patients share their stories with us, which is great. And they, and so I think they feel proud that what they're putting their, many hours of the day towards is something.
So, Kate, we're coming to the bottom of the hour, and I want to thank you. This has been a pleasure. I wish I had an opportunity to meet you in person.
One day, Paul.
One day.
Whether I'm in Chicago or you're in New York, let me know.
That's right. That's right. But I just want to sincerely thank you. This has been a great amount of fun. I hope the audience found it valuable. And I think now I turn it back over to Stephen. Is that right, Stephen? Or Casey? Is that how it works?
No, that's okay. We'll just close it out from here. But thank you both so much, Kate and Paul, for your time. That was a really wonderful session. So to everyone on the line, if you opted in for the virtual networking, you should have a link in your inbox. So we hope to see you there. And thank you again, Kate and Paul.
Thank you. Bye.